Okay, let's call the meeting to order for the Board of Public Health for the Town of Cohasset, October 25th, 2022. This meeting is available on Zoom, and we have our first agenda item is at 6:30 to talk about a well at 110 Jerusalem Road. And who have we to speak about this today?
That's me.
Hi, that's you.
Yeah.
Can you state your name and address for the record?
So I'm Melanie Head, and I'm with Energy Smart Alternatives. We're the company that designed the geothermal system for 110 Jerusalem Road. And so I'm kind of here sort of on behalf of the driller.
Yep.
And we're just looking for permission to drill. It's not a well. It's closed loop boreholes, and we're looking to drill 5 holes for this system, and it'll be used to heat and cool the residence that's currently under renovation.
Okay, can you take us through the plan?
Sure. So the proposed boreholes are sort of in the driveway area. Yep. So there's 5 there, and they're with 15-foot spacing in between. And the depth of each of those, I believe, is about 300 feet.
So
That's
Pam,
about it.
Okay.
So everything gets buried. There's nothing really sticking out. So there's no, and we're not pumping water of any kind. So once the pipes are installed down those holes, everything's sealed up. So there's no, pathway for water to enter the aquifer.
So Pam, if it's not a drinking water well, do we have to approve it?
Well, it looked like for our previous records that the board did do that.
Oh, this has been here before.
I mean, it's not the first geothermal well in town, and I think there is like 1 or 2 other ones in town.
We've done 2.
Okay.
In the past. Yeah. So we typically follow the DEP underground injection control guidelines for geothermal drilling. In the past, we've had approvals just based on following those guidelines. So this meeting is a little bit different for what we've been used to in the past. So that's why I wasn't sure really what you were looking for as far as information.
I mean,
I can answer any questions you have, but
I mean, the only questions I think that I would have are, what's the possible impact to public health? So if there's it's not going into an aquifer, you said?
We're not pumping water at all.
Is there any sort of system to alert the owner if there is a leak? Any sort of leak detection system?
Yeah, the system shuts down. Yeah, so it can detect if the fluid is not, flowing, right?
But it's not like double walled piping or anything of that nature.
No.
Well, I mean, I don't see why we wouldn't just go ahead and vote to approve this. Do you have to go? Presumably you have to go to Conservation Commission and other folks, or is this for permitting?
No, I mean the reason that the paperwork goes to the health department is because it's under the underground injection control regulations through the DEP.
Oh, got it.
So that we always, every town, we always have to go to the Board of Health and request authorization. So we're just trying to follow the usual channels.
Okay, very good. Mr. Joyce.
Hi, thanks for listening to me. So I'm the direct abutter to the property, and I think I have no issue with geothermal. I think it's a good thing. I just have a couple of questions on protection of kind of the water bodies on my property. So
Yep.
the, you said about 300 feet depth. What's
Yep.
the diameter of these wells?
6 inches.
So it's a 6-inch drill rig. And when you're advancing the boring machine, what's the lubricant? Like, are you pumping water in there? Are you pumping water out? And like, where does that slurry go? Or is there any kind of slurry?
No, so we don't add any lubricant. It's the groundwater that's there. And then anything that comes out of the hole, we have to, we contain it on site.
Okay, in
Which
the
it would just be water.
so what's the you had 5 of these. What do you think the time frame is on drilling these, and kind of the noise?
Oh, so they drill typically, I don't know, 8:30 till 3 o'clock, something like that during the day. And I would say maybe 5 to 7 days, weekdays.
5 to 7 total. I'm just asking because the construction's been going on for over a year, and my wife has an office. She works remotely, probably 100 feet from where you guys are drilling. So that's the only reason I was asking on that. So there's no pumping from the wells at all after you do it, and the vibration, there's really no vibration. It's all just borings.
Yeah, so the hole is advanced using a grinding action, not like a hammering, no hammering kind of action. So
Right. Yeah, so the 2 concerns I had were just, there's again, within 100 feet, there's a pond with koi fish in it. I just want to make sure that there was no impact to them. And then just beyond that, there's a pool. So if there's no impact there, and then I'm good. Thank you.
Thank you. Okay, any other comments, Elizabeth? Okay. So I make a motion to approve a permit to install the geothermal well at 110 Jerusalem Road.
A second.
Okay, all in favor? Aye.
Aye.
Motion carries 2-0. And I make a motion to approve the site plan for 110 Jerusalem Road, dated October 5th, 2021, and revised September 19th, 2022.
A second.
Okay, all in favor? Aye.
Aye.
Great, motion carries 2-0. Good luck with the project.
thank you so much.
So we can't approve the meeting minutes from the end of September because I wasn't at the meeting. And so we will have to table that until the next meeting, which would be when? Let's find a meeting date. What, do we have anything on the docket coming up, Pam, that you see?
We will have one septic plan. It's like ready to roll. So there is somebody that's curious when this is going to happen. So if we did a month out, it's the week of Thanksgiving. It'd be like November 22nd. Is that okay? Or would you rather push it off to the 29th?
I mean, the 22nd is fine with me.
Fine with me.
Okay, so should we say 22nd at 6 p.m.? There's only, right now, there's only one. There's only that one septic system.
Yeah, that's all we have so far.
Okay, that's great.
So do you want to do 6 or 6:30?
I could do either. You want to do
6 o'clock?
6 and get it done?
Yeah.
Okay, good.
great.
Okay, 6 p.m. on the 22nd of November.
Excellent. That sounds good.
Very good. Let's see. Up next, what do we have next? Pam, anything you'd like to comment on your weekly reports that have come out over the last month?
So yeah, so tonight we did a flu clinic from 4 to 6. It was pretty filled up. It was really nonstop for 2 hours. We had 3 vaccinators, so we did probably 100 people. And then Saturday, we're going to do our 3rd and final flu clinic. So this time, people that are working and stuff can come on a Saturday. I think it's 10 to 12. And then then we're gonna do COVID clinics. And we planned on doing two, the first week of March, November, first 2 weeks of November, and then the second, two more in the second week in November. Our thought was get them done so that people have, 2 weeks to get their immunity up before Thanksgiving, thinking Thanksgiving typically has been like a super spreader kind of thing. And usually it lasts 4 months. That would take you through the winter. So I think we've had good response. I haven't looked lately to see how many people have signed up, but I think we're doing pretty well with that. And then this week, I'm actually taking off for an annual conference, Massachusetts Health Officers Association, and that's down in Falmouth. So that's Wednesday, Thursday, Friday. I get to learn more about food and septic and other miscellaneous things. PFAS and wells, that kind of stuff. So that'll be good.
Yeah, right.
Good to get out of the office.
Great.
And that's about it. It's luckily it's been kind of quiet.
Have you, just out of curiosity, the COVID stats are not, you see the classification for the county. It doesn't, like, where does that data come from? Do you know? Because I'm not sure it's meaningful, is I guess what I'm getting at. These, like, they have to be confirmed, right? These are confirmed by the state.
Yeah, so I think testing itself is no longer really a viable way to figure out like how things are going, except for the fact that like the ratio, it's kind of, it gives you a picture. We still get our monthly, how we're doing testing wise, and you can kind of tell, is it 10% of the tests coming up back positive versus 5%? It gives you a little bit of a hint. So I think that overall the state is really focused more on the hospitalization rates, the death rates, wastewater, more like that kind of stuff. And then that's how they can kind of get a pretty good estimate of where things stand. But yeah, in the beginning we were doing actual cases, and that's gone. You can't do that anymore.
Right. Is our wastewater monitor for that?
So they do the MWRA because it's a huge population to draw from. And I think they split it in two, and they kind of have a North Shore MWRA number and a South Shore MWRA number.
Got it.
And, it's kind of just a gross number, but trend wise, it just gives you a good idea of which way we're headed, up or down, and so it's been pretty good, I think, pretty good, accurate measurement. And it's funny because I think it's usually ahead of things. They'll start to see the trend going up before you start to actually see the cases hit. Yep, that's what they're going with. So right now.
Awesome. Anything else?
Other than that, it's been pretty quiet.
Awesome.
How about the letter from the abutter to the horse stable permit, or the horse permit?
So that's an ongoing thing right now for sure. They're kind of all fighting it out in conservation because of the stormwater issue.
Yeah.
So both sides have lawyers, both the Bliss family and the abutters do as well. And so up until now, our own town council hasn't really been pulled into it, but now they have to come in because they've been through conservation twice already. And so now it's like, okay, it's time to have a third party now start to really decide who's right and who's wrong between the lawyers.
But in terms of Board of Health responsibility, it's not really on our shoulders at the moment.
Correct. So they initially had sent a letter saying that Board of Health should withdraw the permits, but we went through town council and they didn't bring forth any more new information. And, the decision was made upon the fact that all the different setback requirements were met. There's no additional new information, so there'd be no reason to pull back the permit. So their real argument is with the stormwater piece of it, and the stormwater coming onto their property. So it's best to keep it into conservation.
Makes sense.
If they end up having to update the site plan, would they have to come back then? Probably, right?
They might. I think they might have to, especially if it's dramatically different.
My microphone. Got it.
And you know, they still actually have to go through building as well for
The barn.
because they haven't built the barn yet. You know, it's like in that, it would be going on that third piece of property that they bought, which currently still has a house sitting on it, I think. It would have to be torn down. So they're still a ways away. And
I would
so
say-
it's true. It may circle back here one more time, but I think at that point, it would be, I don't know. I can't imagine. I mean, no setbacks would change or anything like that. So it would just be one more time approving a revised plan or something.
I would have to say, if I were in their shoes also, I would not be building anything until this gets sorted out, right? It just seems like.
Right. And it's interesting too, because we had another woman that came in who was thinking about getting horses in the same general area. And kind of lesson learned, we were like, you know, you should really maybe poll your abutters
Neighbors,
first before you do anything.
Right.
And yeah, and really find out where those wetlands are, because you don't want to find out, oh, I'm gonna have to go and get a variance to wetlands, because that's opens up a huge can of worms. So we're trying to learn from the Bliss property.
So be it.
Yeah. And I think one more thing too, I think at some point, sooner than later, I'm gonna look at our animal regs and maybe do like a red line version of them and make a few changes, because remember there were things like from that South Main Street property where it had to be 100 feet from your septic system. That really doesn't even make any sense. Like, you don't want to build on your septic system, but maybe you only need like a 10-foot buffer. You don't have to be 100 feet away from your septic system. And there are just other minor things, like it says the permit runs from April to April, but that's every other permit we have, you know, is January 1st to December 31st. Why would we have this one off? That doesn't make any sense. And then it says you only have to pay once. Well, it's only $35. They can pay annually. You know, we still have Josh Kimball go out, who's the animal control officer, to do inspections. So there's some obvious changes that we need to make. And then when Carolyn Murray had looked at them, she was saying like, well, there's some holes in this thing, or some places were a little bit too broad or not specific enough. So it'd be good to kind of overhaul these things a little bit.
Yeah, we can do that.
So maybe before the end of this year.
Sure.
Okay.
I mean,
Good.
it depends
That's
on how ambitious you are. We could actually put it on the agenda for the next, for the 22nd.
All right, well, maybe that's
See how-
not a bad idea.
We'll see how
you
ambitious
know,
you
give
are in a
me
week or two
goal.
or three. Yeah, okay.
All right, that's actually a good idea. Okay, I'll try to do that.
All right. Let's see what happens.
Okay.
Okay, and I don't have any other business either. So if we have nothing else, we have a motion to adjourn.
My second?
Okay, very good. All in favor?
Aye.
Aye, motion carries 2-0. Meeting's adjourned.
Right.
Thank
All right,
you.
guys, great.
you. Have a
Next
good
time I
night.
see you, almost Thanksgiving. All right, take
Take
care.
care.
Bye-bye.
Bye.